third thing that I'm talking about is like, we have, as we were talking in Andhra Pradesh, you might have seen that there is this, at all the places we talk about PPP, public-private partnership. In fact, in Andhra Pradesh, we came up one more P and we call it P4. It is like, people bringing in HNIs, bringing in people, those who have got that kind of a wealth, and they can give back to a society, so that rather than owning or investing into one startup, I say that, I am owning up a complete small village. I'll help on these line of businesses, and I'll help these families evolve. I guess that is something that we need to think in a longer run. But also, what we need to see is like, bring in certain kind, because we need to incentivize doctors. We need to incentivize quite a lot of startups in that perspective. So we need to come up with a PPP policy, which really says that, how are the benefits which are going to be passed on. In fact, at all the places we say, then we have got a CSR, we have got a CSR. I guess it's not, CSR is not good enough. We need to think beyond CSR. We need to think, if a certain drug company is helping you to come up with a new kind of a formula or a new kind of a thing, what kind of patent rights can I give them? If can government give them, if that patent is going to be used in a generic purpose, so that more and more people can be saved. So how government is going to give them some other incentives, some other benefits, so that they can think of more working with doctors, startups, and so on. More and more people can be saved. So that is what is the third pillar that we are talking about. Fourth pillar is about the role of society, that how society can pay, can't, because when we are talking about getting a national attention and getting in things, so a lot of people we see that they are striving for getting in good internships. A lot of so in that case, people those are in class 12, those who want to become a doctor, for them to see that it is necessary that a lot of them participate in NSS. So why can't we have similar kind of a thing, wherein they can become first hand to support a good hospital, wherein they can go, they can work with doctors, they can see in OPD. They can only learn about what is happening in sequencing certain things, radiology available or not, but they will get to learn how systems work. So we need to bring in that kind of incentives even for students. We need to think of building in more of NGO based trust gap, which is there are a lot of NGOs, they come into the picture wherein we don't see a clear visibility that what they are actually providing and what they are actually delivering. So from that perspective, clear KPIs. If you come in this area, if you are helping our startups, if you are helping our doctors, if you are helping in oncology, these kind of things we can work on, and we can think about how we can take it forward from there. Last but not the least, the most important things, nations are built on skills. It's not money. So if tomorrow, if we get tons and tons of gold also, or if we get in, like we are saying that, in Arabian Ocean, we have identified oil well to the size of a big South American country. Even if that is good, we won't require oil from anywhere, any other place, and that will bring us to the speed of GCCs. But money is not a solution. The solution of keeping a country prosperous is only skill. And from that perspective, we need to see that what we have learned, from what we have gotten the tons of education or lot of experiences that we have from oncology, how we can bring in that to a doctor. So see, the thing is, a rural village might only can support probably an RMP or maybe a practitioner, GP at the best. He might not have that entire visibility or understanding that an oncologist will have. So from that perspective, if an GP who's actually practicing in a rural place, how, if he is being provided an access that what's happening in this area, or is there certain kind of a help group or a community that can be built out by raising this awareness around AI, with wherein you can learn about what are various kind of cancer diseases, how to address them, what kind of procedures, whom to talk, all those kind of things. This entire intelligence support will not only help the doctors, those who are planning to work in rural India or in the places where you don't have a proper support, but this will also help people to understand that what kind of what kind of systems, schemes, and everything are available. So, like for example, one of my cousin for whom I had come and met, Mr. Chinna Babu. The thing was like, he's suffering from cancer, and only for the injections part, which has to be taken care of, the fee is somewhere around 60 lakhs to be spent. Now there is a scheme of Government of India, and through that Government of India, if you apply that scheme, it is like, you end up paying somewhere around 45 lakh rupees. But after talking to a good number of oncologists, we got to know about that there is certain kind of scheme. So awareness about schemes, awareness about procedures, awareness about experts, awareness about treatments. If you are an GP, what is initial treatment that you can give? Because at the end of the day, if you are able to detect early, if you are able to guide them to the right direction, even if you're not taking care of things end to end, guiding them people and saving lives, I guess that could be a thing wherein a joint policy making at a central level will help, so that survey jana sukhina bhavantu, that happens, that immaterial of whether you have money in your pocket or not, but because we have been believing that healthcare has to be a person's right while they live, this can be planned and this can be delivered. Thank you.